Yeah. Okay, this hearing is now in session and is being recorded to maintain a permanent record. My name is Pete Edlund, and I am the hearing officer today. Today is October 15th, and the time is 1:05 p.m. The purpose of this hearing is to provide an opportunity for public comment on the rules proposed for adoption by the Oregon Health Authority regarding the temporary healthcare staff rate setting program in Chapter 409, Division 039. In addition to presenting oral comments at this hearing, anyone may submit written comments until the 21st at 5 p.m., October 21st, which is the close of the public comment period. Comments received after this time will not be reviewed or considered by the agency as part of the rulemaking process. We will not respond to questions during this hearing. And it looks like we've all I don't see any phone participants, so we got one more person to admit. If anyone would like to speak, either raise your hand or if you're unable to raise your hand with the meeting interface, if you just either put a comment or speak up if you'd like to make a comment on the proposed rule text. And I will throw a link to the filing PDF in the chat. Hello, Ed. Please go ahead.
Hi there. Well, thank you. Ed Lenz with the American Staffing Association. We're still discussing with some of our members the proposed rules, and we may have additional written comments. But one thing that was mentioned in particular had to do with the effective date of the proposed rule or the final rule, and the agreements that the new maximum rates would pertain to. It's our understanding that during information sessions that were held by the OHA, that stakeholders were advised that the new maximum rates would not affect temporary staffing agency contracts with hospitals or facility clients that were in effect prior to the January 1st, 2025 effective date. The American Staffing Association certainly would support that, because it would avoid disrupting previously agreed upon bill rates and the related personnel wage agreements. That would be, of course, highly disruptive, and we appreciate the OHA clarifying that. We do think, though, that it would be important for the final rules to expressly confirm that, so that it would be clear to all that review the rules and implement the rules, that they understand that the maximum rates would apply only to contracts entered into on or after January 1st, 2025. That would be my only thought at this point. ASA reserves the right to submit additional comments in writing by the 21st. Thank you.
Thank you for your comments. Sorry, got one more person to admit. Yeah, everyone is welcome to submit spoken and written, however, either both, whichever you prefer. So thank you, Ed. Does anyone else have a comment they would like to provide at this time? Troy.
Thanks, Ed, or excuse me, Ed. Thanks, Pete, Joe, and team for the opportunity to provide comments today. Also, thanks for incorporating some of the feedback that we provided from the Rules Advisory Committee. Just a couple of things I want to highlight, and then some additional things that we'll share with you in a letter that should arrive here shortly. One, under 408-039-0040, that's that table with the max rates for hospital facility. Thanks for breaking out that registered nurse max rate to reflect sort of the legislative intent of House Bill 2665, as well as the definition of personnel and rule. Additionally, I think we were hoping to see that done for CNAs as well, since hospitals are going to be regulated for these two particular professions. It would make sense to have those max rates differ for these hospital-based employees. So it seems like it would follow not only with the legislative intent, but also with the definitions and rule around personnel for both RNs and CNAs there. Additionally, under the non-emergency waiver, you all have heard this before. That's 409-039-0050. That proposed rule does narrow the statutory text. We think it should be deleted and replaced with rule that aligns with statute. Here, we want to stress that patient access to hospital care is what's at stake in the event that a waiver is not provided. So we want to ensure that patients who need care in a hospital and may not be able to receive it and may face delays if OHA does not grant that waiver. So we want to ensure that the sort of guardrails placed around that emergency waiver are reflecting the intent of the statute and state law. So thank you.
Thank you for your comments. Does anyone else have a comment they'd like to submit for the proposed rules? Now I'm muted. Chat window's way over there. I didn't see this first. Chris, are you would you like to speak on your comment? I just saw your chat.
Sure, thank you for this. Yes, appreciate the comments earlier on the most recent changes to the ruling. This again is 409-039-0020. The 25 or fewer or greater personnel listing and showing to whom the maximum rates apply on here. I noticed that it says it's collectively to all personnel provided by a temporary staffing agency for each single licensed care setting. And it states here per work order or contract, per licensed facility. But how is that going to be measured? Is there to be taken a snapshot in time? Is this to be on a yearly basis? And there really isn't some clarity. I think we need some further clarity along those lines, as well as to how that would be the time that would be implemented.
Okay. Yeah. Thank you for your comment, Chris.
Thank you.
Would anyone else like to speak about the proposed rules? Okay. I have booked the hearing until 1:55. So I will if no one else would like to speak at this point, I will keep the hearing open, but I will pause the recording. And I will hold the hearing open until 1:55 in case anyone shows up late and would like to speak. But for now, I will pause the hearing until
Sorry,
Oh.
I'd like to speak. This is Kristen Millie. with-
oh, fantastic.
Sorry, I'm also for some reason unable to raise my hand.
Oh, interesting.
I've submitted a written comment, but I'd still just like to express concern around the maximum rates that are proposed, particularly around the RN and the LPN rates for long-term care settings. They're still substantially higher than what was being reported as kind of average rates at the highest at the height of the pandemic. So we still have concerns with how these rates are being calculated and how high they are. Thank you.
Thank you for your comment, Kristen, and yeah, thank you for letting me know, both of you, about the issues with the hand raising. Yeah, if anyone wants to speak, also please feel free to just speak up or say so in the chat. Oh, we got another person to admit. Okay, yes, so if anyone else has comments they'd like to provide on the proposed rules adoption, please raise your hand, chat, or speak up now. Okay, if there are no more comments, then I will pause the recording at this point and keep the hearing open. And everyone is welcome to stay or leave as they see fit, of course. Okay, I am resuming the recording. But I will go off camera so we don't have 40 minutes of me not quite looking at my camera. And if anybody does think of a comment they'd like to make, please just speak up or comment or raise your hand. Thank you. Hello, Jessica. This is the public rules hearing for 409-039. Sure, I get temporary
thank you.
healthcare staff rate setting program rules. Did you, not to put you on the spot, did you have a comment you'd like to make on the proposed rules?
Hey Pete, do we need to record it or not, or is it still recording?
It's still recording.
Okay, my bad.
No, yeah, sorry, I paused it and then unpaused it. So, yeah, we'll have a complete record except for the 5 seconds I paused it. Yeah, and Jessica or anyone else, if you'd like to make a comment, please just let me know.
Yeah, thank you. We're here primarily for informational purposes.
Okay, great. Thank you. Hi, Libby. This is the public rules hearing for 409-039, the temporary healthcare staff rate setting program. Um, at the moment, we're just waiting to see if anyone else has comments. So, you're under no obligation. But if you'd like to write a comment on the proposed rules, please feel free. Or anyone else. Hi, folks. Gonna give it about 10 more minutes. It's 1:46. Thank you for your patience. It's always kind of a guessing game as to how much time you'll need, but I'd rather have too much time than not enough. So yeah, if anyone has thought of something they'd like to say, please feel free. And otherwise, just give it about 9 more minutes. Thanks. Hello. One final call, if anyone happens to thought of a comment they just gotta make right now. But otherwise, thank you all for attending and thank you for your comments, those who commented. A reminder that comments can still be submitted in written form on or before October 21st at 5 p.m. And the time is 1:55 and this hearing is adjourned. Thank you all.